Okay, so now what we're going to do is we're going to move into more nuanced, a more nuanced discussion about what we can determine on a 12 lead. So we've talked about STEMI, ST elevation, ST depression, T wave inversion, and we've talked about localizing ST segment changes to certain areas or walls of the heart. But there are a variety of things that we can do with the 12 lead, and this is yet one more layer that we can add on to that. So this is a concept known as axis, or axis. And think of the cardiac axis as the vector, the mean vector in which the electrical activity of the heart flows. And so if you imagine the heart, and I'll just kind of draw a heart right here. Can you guys see that okay? Cool. So if you imagine your heart, and you've got your SA node here, all right, and then your intra-atrial pathways, it gets stopped at the AV junction, it goes down the bundle branches. Okay, so we've got something that looks like that. And so if you imagine the SA node firing, and I'm going to draw these little arrows to represent vectors of the electrical activity as it spreads out through the heart. And you guys see that okay? You can imagine little arrows, it stopped there, goes down the bundle branches, okay, out to the heart, out into the ventricles. Okay, so remember when we talked about vector summation at the beginning of class? And how I can take and I can add two vectors to create a new vector? Now, we don't actually have to do that here in a literal sense, but what the axis is if I add up all of the major vectors of electrical activity through the heart, okay? So all these little arrows, if I kind of add them up, I'm going to get a vector that represents the average direction in which the depolarization occurs through the heart. Does that kind of make sense? Sort of? Okay. So when we talk about axis, we're not talking about individual cells. We're saying, what general direction is the depolarization moving? What's the general? What's the average direction? Right? If I add up all those individual vectors, they're going to add up to a one single vector that is going to represent more or less where all the electrical activity is moving. And if you guys had to guess, where do you think more or less all the electrical activity moves in the heart? Yeah, so it starts where? Top. Right. Would you guys agree? It starts at the top right and it goes down to the bottom left. Okay, so the average direction in which all of the electrical activity moves, again, we're talking average here, right? And you could imagine an arrow like that. Does that make sense? That arrow represents the axis. Okay, the general direction in which the wave of depolarization moves. Is everybody okay with that so far? Okay, cool. So what we've done, and this is completely arbitrary here, we could have done this very differently, okay? But this is just kind of how the pioneers of this is how they did it, and this is what stuck. Okay, so what we've done is, we have made a circle around the heart. So I want you guys to imagine that there's a circle, okay? And that's this drawing right here. So make a circle around the heart, okay? And what we've done is we've started at our limb leads, okay? And we've started at lead 1. And lead 1 looks in this direction. So imagine that there is an eyeball here, okay? Okay, and then lead 1 looks in this direction. Is that, you guys okay with that? And so what we've done is we've said, okay, we're going to make that particular direction 0 degrees. Okay, that's 0 degrees, straight, looking straight into lead 1. You guys okay with that? And that kind of makes sense, right? Lead 1 is where everything starts, and so that's our baseline, 0 degrees. You guys okay with that?
Yep.
All right. And then we go to lead 2. Now lead 2 is kind of down here, and it's looking, okay, at about a 60-degree angle. Okay, so the angle between lead 1 and lead 2 is about 60 degrees. You guys okay with that? Does that kind of make sense? And then lead 3, okay, there is a 60-degree angle between lead 2 and lead 3, right? Okay, so if lead 2 is at 60 degrees, lead 3 is going to be down here at 120, right? So lead 1 looks at 0 degrees, lead 2 looks at 60, excuse me, lead 3 looks at 120. Are you guys okay with that? Draw those circles there. All right. And then what can we do if we take vector summations of the limb leads? What leads can we create? Our augmented leads, right? So let's start at AVL. Okay, AVL is here, okay, and it's looking at a negative 30 degree. So when I go below the 0 degrees, do you guys see that there? Going below 0 degrees results in a positive. You guys okay with that? Going above 0 degrees results in a negative. Now, could have I just made this a complete circle from 0 to 360 degrees? We could have. Again, this is just how it all turned out. Okay, so this is a convention that we go with. All right? So the top part here goes from 0, okay, all the way through the negatives to 180 degrees. So all the way around to 180 degrees. These are all negatives. And then the bottom part starts at 0 and goes from 0 all the way to 180 degrees, and it includes all the positives. Okay? So instead of 360, it's 180 and 180. You guys okay with that? Does that kind of make sense? So basically, what we're doing is we are representing a circle around the heart. And then the leads, the individual leads, are taking views of the heart at different angles relative to lead 1 at 0 degrees. Does that make sense? Okay, again, it's arbitrary. We could have done this in so many different ways. This is just kind of the system of measuring axis that we do. Okay. So let's talk about AVF, augmented vector front, looks right here at positive 90 degrees, okay? And then AVR is way over here, okay? The eyeball is way over here on the right shoulder, so it's looking at negative 150 degrees, all right? You guys good with that? And then I just, for the sake of completeness, I put in a positive 30, positive 150, a negative 120, a negative 90, and a negative 60. Okay. So these are the angles that the leads are looking at. Okay. You guys good with that? So if you had to imagine, let's draw that arrow in for what a normal axis would be like. What did we say? The electrical activity is going to start up here. And where is it going to end, more or less? It's going to end down here, more or less. Would you guys agree? Okay, so if I drew an arrow like this, would you guys agree, more or less, that this would represent the mean axis of electricity through the heart? Would you guys go along that ride? Yeah, that's normally how the electrical activity on the average goes through the heart, the normal direction. And so, down here, the normal axis, okay, is an arrow that goes from 0 to positive 90 degrees. And does that make sense why we would say that's normal?
Yeah, because of the.
Yeah. So so this general area here, okay, is your normal axis from positive 90 to 0 or 0 to positive 90. Does that kind of make sense? Now, if I have problems, let's say I have some sort of block that prevents or slows depolarization to this area of the heart, right here on the left, then that arrow is going to shift to it's going to shift over to the right. If I have problems over here that prevent conduction to the right, it's going to shift to the
Left.
or maybe the left side gets very large, like large hypertrophy, for example. So there's more depolarization occurring, that arrow's going to shift up toward that way, right? Or let's say I have lots of hypertrophy on the right side, and it gets enlarged, and there's more depolarization occurring there, then that arrow is going to shift to the right. Does that make sense? So that's where we get what's called axis deviation. And that is where the mean electrical axis deviates from this 0 to plus 90. Okay, that arrow that represents the average electrical, the average direction the electrical activity takes through the heart is going to shift up or down. It's going to shift away from that normal range. Are you guys okay with that? Okay, so let's talk about some ways it can shift abnormally. Okay, so the first thing I'm going to talk about is right axis deviation. Right axis deviation. This is also known as RAD. Do you see where the arrow is? See how it's shifted to the right. Right axis deviation is a mean vector between positive 90 degrees, so that's down here, okay, to 180 degrees, down here to up here.
Now how do you know if it's a positive or negative 180? Just depending on.
It's just yeah, it's 180 is 180. So I just
Okay.
put a plus minus there because it's just 180. Yeah.
Okay.
Does that make sense? Yeah. Just like 0, it's, yeah. That's
Okay.
that's just the baseline there. You guys okay with that? What kinds of things can shift the axis to the right? That's kind of good to know, right? If you see that your patient has right axis deviation, you should be able to.
How can you see that?
I'll show you here in a minute, yeah. I want to talk about it first, and then I'll show you how to identify it or diagnose it. So, right bundle branch block, okay. Right ventricular hypertrophy, or RVH, okay. The right ventricle is enlarged. Pulmonary diseases, and a particular kind of disease known as cor pulmonale. This is a right-sided heart failure associated with chronic obstructive pulmonary disease that tends to cause RVH, right? Because if you have lung disease, sometimes the heart has to work very much harder to get blood through the lungs. So it gets strained, it begins to fail, it enlarges, okay? And so people that have chronic lung disease that develop right-sided heart failure, develop this cor pulmonale, often will have some degree of right axis deviation as a result of that. Does that make sense why? People who are very thin may develop some degree of right axis
Is that what
deviation.
you're talking about with Cole?
No, he has some, yeah. And something known as left posterior hemiblock. We haven't talked about hemiblocks yet, and we won't today. I hope to talk about them on Wednesday when we talk about STEMI mimics, or finished STEMI mimics. But basically, your left bundle branch is divided into different fascicles. And there are two major fascicles in the left bundle branch. There is the part of the left bundle branch that supplies conduction to the front of the heart, and that's called the anterior fascicle. And then there is the part of the bundle branch that goes down to the posterior part of the heart called the posterior fascicle. So blocking the posterior fascicle would cause a left posterior hemiblock. Blocking the anterior fascicle would create a left anterior fascicular hemiblock. And if you block both fascicles, you would have a left bundle branch block. You'd be blocking the entire bundle branch. Does that make sense? But left posterior hemiblocks tend to cause right axis deviation there. Okay, you guys okay with that? All right, so let's move on. Let's now talk about extreme right axis deviation. Okay, so extreme right axis deviation goes between 180 down here up to -90. This is also known as right shoulder deviation, and some people will even call it no man's land. No man's land. What tends to cause this? Stuff originating from the ventricles tends to cause right shoulder axis deviation. And that makes sense, right? If I have a PVC, for example, that originates in the ventricle, I'm going to get what kind of movement? I'm going to get retrograde depolarization that's going to move up the heart toward the SA node, right? And so it should be clear, oh, yeah, that would explain why you'd have extreme right axis deviation. You guys, does that kind of make sense? Okay. Obviously, myocardial infarctions that can severely damage the conduction system may cause this. Okay, ventricular escape rhythms may cause this. And this may be a method, and I say may because it's not always the case, but it may help you when you are trying to differentiate between SVT with aberrancy and ventricular tachycardia. In general, VTach tends to have more extreme right axis deviation, and that kind of makes sense, right? Now, this is not always the case, but if you see that a tachycardic rhythm that has extreme right axis deviation, that supports a VTach hypothesis a little more. So you can use axis as a way of zeroing in on VTach versus SVT in some cases. It's not always the case, but it does give you some degree of evidence. You guys okay with that? Okay, so let's move on and talk, but pathological left axis deviation is something abnormal, something pathological, something we need to worry
Wait,
about.
Did you just say from -30 to 90 on that last picture was nothing?
To plus 90,
Oh, okay.
right?
Okay.
Let me go back here. You
Okay.
see that there?
Okay, so from the plus 90, okay.
Yeah,
That's how I-
does that make
Yeah,
sense?
I didn't hear the plus,
Okay,
or see
okay.
the plus on
All
the
right.
thing. Okay,
All
that
right.
makes sense.
So, yeah, you guys okay with that? Good with that? Okay, cool. All right, so pathological left axis deviation, however, move this out of the way so we can see. All right, is going to be between -30 up here and -90. Okay, far left. It's basically going up toward the left atrium there. You guys see that? Okay. What kinds of things cause this? Well, severe obesity can cause it. If you have a misplaced heart or a horizontal heart, so maybe your heart is just in a odd position, that can cause it as well. Left bundle branch block. Left ventricular hypertrophy. This is also known as LVH. What's ascites? Yeah, a collection of fluid in the abdomen can push the heart up out of its normal anatomical position. Left anterior fascicular hemiblock instead of left posterior. Pregnancy is a big one. Pregnancy can definitely cause that. Because what does pregnancy do? It pushes up on the baby. and then the presence of inferior wall myocardial infarction. Okay, so if you compromise this part of the heart, right, that makes sense that the axis would shift away from the area that's damaged and toward the left. You guys okay with that? It kind of makes sense? Cool. So now the next question is, all right, I know what axis is, but how do I determine axis? Well, let's talk about that. How do we determine axis? Well, let me zoom in here. There are a couple of things you can do. The first thing is find the QRS axis on your 12 lead. Okay, so this is a 12 lead printout, and this is actually off the Zoll. So you see right here where it has PRT axes right down there on the lower left. You want to go with the one that represents the largest amount. Yeah, everybody's going to look at their 12 leads now, huh? Good. So this is perfect to do the the posterior and V4R lab and then do this, because now you all have 12 leads you can look at. So do you think the P, the QRS, or the T complex is going to represent the majority of the electrical activity?
The QRS.
The QRS, right? So you're going to look at the QRS or the R axis there, okay? And then over here, it's represented by the 81. So the R axis in this particular case is 81 degrees.
So you always take the highest number?
No, not always the highest number. See how it says PRT axes there? Do you see that there? PRT.
Right.
We're going to look at the R, because that's the
Oh,
QRS,
okay.
right? That's the majority of the electrical activity, right? Okay, so the P would be 70, the R would be 81, and the T would be 47. Okay. So find the QRS axis, okay, and then just remember, what's your normal axis? 0 to plus 90, good. So is this normal? Is this abnormal?
Normal.
This is normal. Does that make sense? Okay. How cool is that, huh? All right. Now, the other method.
Chris, real quick.
Yeah.
Will that show the axis on the 12 lead, 0 to 360, or with the negative 180? You know,
Yeah, it'll show negatives.
It'll show negatives?
Yeah, it would be like negative 90, and I'm going to show you some examples, but I don't think the examples have this printout associated with them, but it sure will. It definitely will. Yeah, so it'll be like negative 30 or, whatever, yeah. You guys okay with that? Make sense? Okay, now the other way to do that is to come up here and look at your limb leads. 1, 2, and 3. And let me just move this here, and I'll draw right here. So I'm going to draw the heart here again. And I want you guys to tell me, where's lead 1?
0 degrees.
Lead 1's right here at 0 degrees. So lead 1, my little eyeball, right? So 0 degrees. What's lead 2?
60 degrees positive.
60, no, wait, positive.
Yeah, so if I draw, this is positive or negative down here?
Positive.
Good. Positive 90 degrees. You guys okay with that? So 60 degrees is going to be more or less here. You guys okay with that? All right, so I'll draw my little eyeball here. All right. And then the electrical activity is moving in this direction toward the eye. You guys okay with that? So this is lead 1 right here. This is lead 2 at positive 60 degrees. And then where's lead 3?
Positive 120.
Good. So it is over here. And then I'll draw another little eyeball. All right. And this is at positive 120, and that is lead 3. What do you notice about the electrical activity on all 3 leads?
It's moving towards the positive direction.
In a normal heart, the wave of depolarization, okay, is moving in this direction, right? And so it is moving toward, more or less, toward all three leads, right? Toward the positive, right? The eyeball is representing the positive electrode, right? So if you have normal axis, what would you expect the QRS complexes to look like?
Upright.
They'd be upright. You guys okay with that? So if the axis is normal, your QRS complexes are gonna be upright in 1, 2, and 3. Does that make sense why it would be upright? Okay, cool. Isn't this crazy? I'm just it's just crazy that you can determine this. All right, so normal axis, your QRS complex is going to be upright in 1, 2, and 3. All right. So far, so good? Let's talk about physiological left axis deviation. Where is physiological LAD occurring?
0 to -30.
So physiological LAD is going to be right in here, right? Physio LAD. You guys good with that? So if you had to imagine the arrow is moving in this direction now, so what should lead 1 look like in physiological LAD?
Upright.
Yeah, it's moving right toward 1, so you would expect 1 to be up. What about lead 2?
Upright.
It's still more or less going toward lead 2, right? What about lead 3?
Way down.
Yeah, it's starting to move away from lead 3. And the further up you go into physiological left axis deviation, the more downward lead 3 should look. And so with physiological LAD, one is definitely going to be up. Would you guys agree? Lead 2 is either going to be upright or it may take on a biphasic appearance the further up you go into the physiological LAD, right? Because it's shifting a little bit away, but some of it is still going toward, right? So you get this biphasic QRS where half of the QRS is up and half of it's down. Does that make sense? But lead 3 is definitely going to be down because it is shifting away from lead 3. Now let's go from physiological LAD to pathological LAD, which is
-90 to -30.
right in here, right? Would you guys agree?
Yep.
Pathological LAD is going to be in here. So we are definitely shifting toward lead.
And
Or just the limb leads.
1.
Yeah, so lead 1 is going to be what?
Positive.
Yeah, so regardless of the type of LAD you're dealing with, lead 1 is always going to be upright because lead 1 is on that left side, right? And you are definitely shifting away from leads
2 and 3.
2 and 3. So what would you expect?
Down. Or 2, yeah, 2,
Yeah.
I showed down, both.
So with pathological left axis deviation, you're going to see up in 1, down in 2, and down in 3. Up, down, down. And that makes sense because remember, the more you go up into physiological, the more biphasic the QRS looks like in lead 2 until you go into pathological LAD and you're now full on down in lead 2, right? So up, up, up is normal. Up, up, / biphasic, and down is physiological LAD, and then up, down, down is a solid LAD, left axis, patho. You guys good with that? So far, so good? Okay, so let's move over here. Maybe I'll just change the color a little bit. Here we go. So where's right axis deviation?
-32.
-30?
No, positive 90, wasn't it?
Positive.
180, positive 90 to
Yeah, so positive 90 to
180.
right in here, right? Okay, so with right axis deviation, what am I definitely headed? 3, right? So you would expect 3 to be positively deflected, okay? What about lead 2?
Can be either or, up or down.
Okay. What about lead 1?
Negatively deflected.
It's definitely moving away from lead 1. So when we go back down here to right axis deviation, you guys nailed it. You just nailed it. It's definitely going to be down in lead 1, right? It's definitely going to be up in lead 3, right? Because lead 3 is looking on the right side. And then you could get a variable up, biphasic, or down in lead 2, depending on how far right it is. And does that make sense why we would get that? All right, you guys cool with that? And then finally, if we look at extreme right axis deviation, where's that going to be at? Maybe I'll choose a different color for that, blue. Where's that at?
180 to negative 90.
Yeah, so 180, negative 90. It's going to be in here. Which of your limb leads looks in this which of your limb leads looks in this direction here?
3 is the closest.
Yeah, but again, if it's moving in this way,
Okay.
it's still perpendicular to lead 3. So lead 3 is going to be down. Good. What about lead 2? Is exactly in the opposite direction, so lead 2 is going to be down. What about lead 1? There you go. Down, down, down is extreme right axis deviation. And there you go. Down, down, down. How cool is that? Isn't that amazing? It's almost mind-blowing when you think about it. Okay, so let me give you guys a couple of examples real quick. All right, and again, I have shamelessly stolen these, but I have referenced them for educational purposes only. Okay, so this first one here is an example of pathological left axis deviation. So let's look at our QRS complexes. All right. So what is it in lead 1? It's up in lead 1. It's positive. Good. What about lead 2? It's down. And then lead 3? Down. And does that jive with pathological left axis? Right? We would expect that, right? We'd expect an up, down, down. How cool is that? All right. Let's take a look at right axis deviation. And maybe I'll zoom in a little more since we've got a low voltage in 1 there, but we'll zoom in there. Okay, so what direction is 1?
Up and
Down. Primarily down, though.
down. Okay.
Yeah, more or less. Lead 2, up. Lead 3, up. What does that give us?
Right axis.
Right, yeah, down, up, up. You guys good with that? Down, up, up. So that does give us right axis deviation. You guys cool with that? All right, let's take a look at another one here. Let's take a look at this thing here. So lead 2 is,
2?
yeah, or 1, I'm sorry, 1 here. 1 is down, right? QRS is pointing down. Lead 2, it's pointing down, you guys agree? 3, again, it's pointing down. What does that give us? Extreme right axis deviation. Yeah, you guys good with that?
Why does it say 229 degrees up in QRS on the
Oh, right here?
axis are?
Oh.
Because this one,
229 would be, if you look at a clock.
Yeah, so the software in this monitor here did something funny. It instead of with the standard thing that we learned, it converted all that into a circle from 0 to 360.
only on the QRS though, because your P and T.
Yeah, isn't that weird? Yeah. And again, that's why you may have to rely on the limb lead system of doing it. Now, the software Okay, so if you look here, the software, in this particular monitor, doesn't just come out and say it, but it does say unusual p-axis, ectopic tachycardia, but, right, so it's giving you some information, it just doesn't come out and say, oh, yeah, extreme right axis deviation, right? You have to make that call. So that's why it is helpful to know both the looking at the axis and the lead method for determining axis. You guys okay with that? Now there are actually several different lead methods that use different leads, like one in AVL, one in AVF. Okay, there are many ways of doing that, but the limb leads I find tend to be the easiest because it makes sense. Like, okay, it makes sense because I can imagine where those limb leads are looking. And so that's kind of the technique that I've always taught. You guys okay with that? Does that kind of make sense? Excellent. Well, let me go ahead and get you guys on a